الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Q fever, it is due to Coxiella burenti infection. It is an occupational infection by Professor Mahmoud Hani Sulaiman. Q fever. Epidemiology of Q fever. Etiology. Coxiella burenti is the cause of Q fever. Previously was considered rickettsial organism, but is a gram-negative intracellular bacterium. It is now considered a gram-negative intracellular bacterium. Belongs to order Legionella, family Coxiella The infectious form of Coxiella burenti, highly resistant to heat, desiccation, disinfectant chemicals, can persist for long periods in environment. This organism is classified as category B bioterrorism agent. It is a bioterrorism agent. Epidemiology. Is a zoonotic infection reported worldwide? Q from query. Fever, name of disease until its etiologic agent identified in 1930s. This infection usually is asymptomatic in animals. Many species infected, but cattle, sheep, goats are primary reservoir for human infection. Cattle, sheep, goats. Tick vectors may be important for maintaining animal and bird reservoir, but not important in transmission to humans. Man mostly acquire infection by inhalation of aerosols of Coxiella burenti generated from birthing fluids or excreta of infected animals, or by inhalation of dust contaminated by these materials. Either inhalation of these materials or of the dust contaminated by these materials. Epidemiology continued. Infection occur also by exposure to contaminated materials as wool, straw, bedding, or laundry. Wind-borne particles containing organisms travel prolonged distances. Wind-borne particles travel prolonged distance, contributing to sporadic cases for which no apparent animal contact can be demonstrated. Unpasteurized dairy products can contain organisms. Seasonal trends occur in farming areas with a predictable frequency, and disease often coincides with livestock birthing season in spring. يبقى seasonal coincides with livestock birthing season in spring. This photo of calm ships beside the ocean, but it is overloaded with a story. These domestic sheep lying on Ireland with Atlantic Ocean in background. In 2004, Ireland had almost 7 million domestic sheep. This year, Irish state exported more than 51,000 tons of sheep meat, equal 165 million euros, a big amount of money. This was under the threat of this disease. Livestock industries can present health hazards for producers and consumers. Disease transmitted from animals to human called zoonosis. Q fever, Coxiella burenti, is passed to human from sheep. People working around domestic sheep should consider vaccination against this disease. Disease acquired from inhalation of aerosolized barnyard dust if it contains infected dried urine, manure, particles. If this dust contains dried urine or manure particles or dried fluids from birth of calves or lambs. Domestic animals present problems for their handlers, i.e. farmers, or for consumers when animals are used for food. Food products made from animals include meat and meat derivatives. Meat derivatives is very important. Why? Because they are added to sweets and other foods and therefore are less obvious to consumers. Occupational settings for zoonotic exposure. Occupational settings for zoonotic exposure. First, contact with live animals. This is among veterinary workers, animal farmers, zoo workers, hunters, trappers, fishermen, fish farmers, animal trainers, animal sanctuary workers, cruelty inspectors, pet shop workers. These are in contact with live animals. Those in contact with animal carcass or byproducts are abattoir workers, slaughtermen, butchers, meat inspectors, workers with animal skin, hides, and hair, fishmongers, catering industry workers. Those are in contact with animal carcass or byproducts. Also, laboratory exposure to infectious animal specimens, veterinary laboratory workers, animal researchers, medical laboratory workers. What about environmental exposure? Those agricultural workers, forestry workers, sewage workers, outdoor activity instructors, and guides. Incubation period from 2 weeks to 3 weeks, depending on inoculum size. When the inoculum size is large, the incubation period is smaller. Persistent localized chronic Q fever can develop months to years after initial infection. Initial infection happens and chronic Q fever occurs after months to years. Clinical picture of Q fever. About half of acute Q fever infections result in symptoms. Let's say other half does not result in symptoms. Acute and chronic forms of disease exist and both can present as fever of unknown origin. Q fever in children typically is characterized by abrupt onset of fever, chills, headache, weakness, cough, and other non-specific systemic symptoms. Illness typically is self-limited, but relapsing febrile illness for several months is reported in children. GIT symptoms as diarrhea, vomiting, abdominal pain, anorexia reported in up to 80% of children. Rash observed in some patients with Q fever. Q fever pneumonia usually manifests with mild cough, shortness of breath, but can progress to respiratory distress. Chest X-ray variable. Chest CT may show multi-lobar airspace consolidation. Immunocompromised patient, a nodular pattern with ground glass opacification. In immunocompromised, a nodular pattern with ground glass opacification. Vessel connection or findings suggestive of necrotizing process may be seen. Clinical picture continued. More severe manifestations of acute Q fever are rare but include a long list: hepatitis, hemolytic uremic syndrome, myocarditis, pericarditis, cerebellitis, encephalitis, meningitis, lymphadenitis, hemophagocytosis, acalculous cholecystitis, rhabdomyolysis. Persistent localized chronic Q fever is rare in children, but can present as blood culture negative endocarditis, chronic relapsing or multifocal osteomyelitis, or chronic hepatitis. Children who are immunocompromised or have underlying valvular heart disease are at increased risk of persistent localized Q fever. Diagnosis: a fourfold increase in IgG, by IFA is the diagnostic gold standard to confirm diagnosis of acute Q fever. Single high serum IgG titr 12128 by IFA is a diagnosis of probable infection. Chronic Q fever equal increase in IgG titr 1 to 1024. That is often is higher than in phase IgG titr and identifiable nidus of infection. It can tell us about endocarditis, vascular infection, osteomyelitis, chronic hepatitis. Diagnosing using PCR is good, although positive PCR can confirm diagnosis. It is found only in in some little number of labs. Detection of buoyancy in tissues, e.g. heart valve, by immunohistochemistry or PCR can confirm diagnosis. Treatment: acute Q fever is a self-limited illness, and many patients recover without antimicrobial treatment. Early treatment will lead to shortening of illness duration and decreased severity. So, initiate the treatment in symptomatic patients. For patients with suspected disease, empiric treatment should be given. Why? Lab results are negative early in illness. Doxycycline orally 2 times per day for children more than 8 years for 2 weeks is the drug of choice. Doxycycline orally, drug of choice. Used for acute fever regardless of patient age. Children less than 8 years or those pregnant women or those allergic to doxycycline treated with trimethoprim with sulfamethoxazole. Persistent chronic Q fever is difficult to treat. Recommended treatment for Q fever endocarditis is doxycycline and hydroxychloroquine. You remember something when I say this, hydroxychloroquine, something called COVID-19. يبقى recommended treatment for Q fever endocarditis is doxycycline with hydroxychloroquine, minimum of 18 months, 1.5 years. Surgical replacement of infected valve may be necessary. This is an X-ray of patient at time of admission before intubation showing extensive bilateral airspace disease. Extensive bilateral airspace disease. First cases of fever recognized in Nova Scotia in 1979. Q fever was common in Nova Scotia, and here is the incidence: about 60 cases per year in a population of around 1 million per year. Here is immunohistochemical detection of Coxiella in a resected valve from patient with Q fever endocarditis. Note the intracellular location of bacteria in macrophage cytoplasm. Now we are talking about prevention. Thanks God, we have a wholesale vaccine. It is called QVax, licensed in Australia, effectively prevents Q fever in abattoir workers. It is occupational disease. Before giving vaccine, skin testing with intradermal diluted purity vaccine is performed. يبقى with intradermal diluted Coxiella purity vaccine is performed. Serologic testing is undertaken and history of possible Q fever is sought. Vaccine is given only to those with no history of Q fever, negative results in serology, negative skin testing. يبقى it is given for abattoir workers of whom no history of Q fever, negative results in serology, and negative skin testing. During an outbreak of Q fever and for 4 weeks after it ceases, blood donations should not be accepted from individuals who live in the affected area. Good animal husbandry is the main way for prevention. These practices include isolating aborting animals for 2 weeks, raising feed bunks to prevent contamination of feed by excrete, destroying aborted materials by burning, burying fetal membranes, stillborn animals. Wearing masks and gloves, again, when handling aborted materials. It is a droplet infection. Only seronegative pregnant animals should be used in research settings. Only seronegative pregnant animals used in research settings. Only seronegative animals permitted in petting zoos. Only seronegative animals permitted in zoos. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.